This is 71-year-old Adriana Bayer. It is now 8 months since she had a posterior cervical decompression and fusion operation.
I have had years of neck pain. The pain in the neck was really usually in the middle, but also in the sides, and more on movement than when it was still. I had a lot of headaches as well, and other times not as strong, but really getting to you because it's there all the time. Unless you take painkillers, it would be there all the time. And I think that gets to you, whether it is severe or not. It depresses you, it stops you from doing things, which depresses you. So it was really difficult to live. There was a lot of problem and a lot of pain early in the morning. So if I had a long, deep sleep, then it would take me from 7:30, 8 in the morning till 10:30, 11 o'clock to be able to have some movement. I have 4 families, 4 children, 4 families, and 20 grandchildren. And I've always enjoyed them, and I like to be active with them and do things with them, or really go out with them and they go out and so on. And I was really in the last 1 or 2 years before the operation more and more restricted and also depressed to go. I did not feel like anything anymore. I think pain gets you to bed quicker, you lay down quicker, and you don't feel like doing things. When it started, it was sort of just painkillers. And as it got stronger, I went to the doctor and asked for anti-inflammatory tablets, so I could take that as well as the painkillers. And I was realizing, apart from stomach trouble a bit, that I was taking far too much, which is not good for your body. I had pain for a long time, but it was the last 1 or 2 years that I thought, I can't live like this anymore. Quality, quantity, you think about all these things, something got to be done. So one day I asked my doctor that, I said I just cannot put up with this anymore if I want to have a bit of life, a quality of life, and do things. I said, I do want to see an orthopedic surgeon. So he gave a referral.
Scans revealed Adriana had significant osteoarthritis in her spine. The disc between the 4th and 5th cervical vertebrae showed significant degeneration and decreased height. Her spine surgeon recommended an operation.
I had many reasons really to listen to the advice and go for the operation.
Adriana's problem is a common one. When a cervical disc is damaged, the softer middle part of the disc or parts of the outer disc can extend outwards and press on spinal nerves. The opening at the side of the spine may also be reduced, pinching the nerve. This nerve irritation can cause pain, changes in sensation and muscle weakness. The aim of a posterior cervical decompression and fusion operation is to relieve pain by freeing up pinched nerves. Fusion helps stabilise the spine. A vertical incision is made at the back of the neck, just above the hairline. Muscles and ligaments are delicately moved aside. Bone and damaged disc material pushing on the nerve is then carefully removed. This frees up the nerve which has been causing pain. Sometimes a fusion is also required. Stability is achieved by inserting screws into each side of the spine above and below the level of injury. Rods or plates are then secured into the screws to create a rigid frame which stabilises the spine. Bone graft from the operation site or bone graft substitute is then placed around the fusion site. This will eventually form a solid bridge between the vertebrae, providing stability. The wound is closed to complete the procedure, which usually takes about 1.5 to 3 hours. Possible complications of the operation include, but are not limited to, wound infection, leakage of cerebrospinal fluid from your spine, deep venous thrombosis or blood clots, nerve root injury leading to movement problems, pain, changes in sensation or loss of function, reaction to anaesthetic or drug therapy, excessive bleeding, hematoma or bruising, and fracture of a vertebra. Some of these conditions are serious and ongoing, while others resolve over time. If you are concerned about possible complications, speak to your surgical team prior to agreeing to have the operation.
The decision making is very hard. whether to go ahead with an operation or not. Things can go wrong, of course I knew that with an operation, but I know that it's also often a small percentage, or surgeons wouldn't do it either. I knew that was the risk I had to take.
While success rates vary from patient to patient and depend on the circumstances of each individual case, conservatively, research suggests there is an 80% chance patients will receive good pain relief from this operation. The goal of surgery is to reduce pain by 80% or better. In patients with muscle weakness, this operation will not always result in restoration of strength, but the goal of surgery is to prevent further weakness.
Well, if I compare the pain I had in the few months that I saw the surgeon to now, it is just amazing. Miracle to me, really. So I am very grateful that I had it done, and I'm very happy with it. Yeah. The pain at the moment isn't there. If I do a lot of side looking, and sometimes if I do a lot of driving, then I do feel a bit of pain, but it's not warranted for Panadine. I must say the procedure and the operation itself was difficult. It was really major. I was in hospital for 6 days, and when I came home I had family support here for 10 days, people staying here and sleeping here. You need help for a few weeks constantly, and then for the next few weeks it is very good if you have with a family or someone coming in.
Adriana began gentle physiotherapy about 6 weeks after her operation. She has an ongoing exercise program.
I think up to 3 months I thought, oh, should I have done this? Till the time came when the collar was allowed off for like half an hour in the morning, half an hour at lunch and half an hour at night or so. I had more movement than I ever thought I would have. I found out that although it's all fused, it must be all together that I can move to the left, to the right, even up. And I said, well, it doesn't matter about up, I don't have to see the stars, but I would like to do some work and look down. And there came a stage, I think at 3 months or 4 months, that I hadn't improved a lot, and the physiotherapist said, well, you might be at your limit now, which I was quite happy with because it was further than I'd ever had before, the couple of years before. So I was quite happy with that. You never expect to have a brand new neck out of this, but to me it was a new neck.
Adriana was totally self-sufficient after about 3 months, and she's now back doing the things she loves.
Now I can drive. I drive a lot all the time. I do little trips, and a few big trips I've done now, and I do not take the painkillers. So that is incredible to me. It is amazing. I mean, it really is amazing. I do think that you forget pain. So I now forget. It's now 8 months, and I am beginning to, since 6 months, the 6 to 8 months, I'm beginning to get into a bit of problems because I forget to exercise because I'm so good. I forget, if I don't have pain, you forget that you have to do that, really. It's been a really good thing for me to do. I have never regretted it. I have more movement than before, and that's what I was aiming for, to have less pain and have more movement. So yes, I am glad that I've listened to the medical world, to the medical people.